What is the outlook for patients with AML?
The outlook is very variable. Some patients have a fairly high likelihood of cure and of living for many years. Other patients, particularly those with therapy-related AML, AML that rose from myelodysplastic syndrome, those who are older and can't tolerate therapies, their outlook is much more guarded, and their survival might be measured in months to a few years. A lot of the outlook depends on who the patient is, what other medical problems that they have. Someone who's young, 25 years old, healthy, in general is going to have a better outlook than somebody who's 78 or 80 and has other significant medical problems. It's also determined largely by the genetics of the blasts, not the genetics the person was born with, the genetics specifically in the cells, the particular mutations. So for instance, there are certain chromosome changes that we lump together as core binding factor leukemias. The majority of those patients will go into remission with therapy and be alive and disease-free 5 years later. There are others who have a very complex pattern or mutations in a gene called TP53. Most of those patients will pass away within a year of diagnosis. So very variable, but a lot depends on both the disease and who the patient is.